We're tackling a big topic today: autoimmune diseases. These are conditions where your immune system, which normally protects you, mistakenly attacks your own body. Think of it like this: your immune system, it's like a security system trained to fight off invaders like viruses and bacteria. But in autoimmune diseases, it's like the alarm system goes haywire, mistaking your own cells for threats. And in this video, we're going to break down the top 10 most common autoimmune diseases, explaining what they are, how they affect you, and most importantly, the latest treatment options. Number 10, Rheumatoid Arthritis, or RA for short. Now, this isn't your grandma's osteoarthritis, which is caused by wear and tear on the joints over time. RA is a full-blown autoimmune disease where your immune system decides to target the lining of your joints, leading to pain, stiffness, and eventually joint damage. And it can affect anyone at any age. Imagine feeling like your joints are constantly stiff and swollen, making even simple tasks like opening a jar or walking upstairs a painful ordeal. That's the reality for millions of people with RA. The inflammation not only causes pain, but it can also lead to the destruction of cartilage and bone within the joints, resulting in deformities and reduced function. But the good news is we've made incredible strides in managing RA. Medications like DMARDs, which are disease-modifying anti-rheumatic drugs, and biologics can help slow down the disease progression and prevent further joint damage. Number 9, lupus. Next up is another complex autoimmune disease that can be really tricky to diagnose. Why tricky? Well, because lupus can mimic so many other conditions, earning it the nickname the Great Imitator. You see, with lupus, the immune system goes haywire and starts attacking healthy tissues and organs throughout the body. This can lead to a wide range of symptoms, from fatigue and joint pain to skin rashes and kidney problems. One of the most recognizable signs of lupus is a butterfly-shaped rash that appears across the nose and cheeks. But keep in mind, not everyone with lupus is going to develop this rash, and that's why it makes lupus so challenging. Its symptoms can be really unpredictable, varying from person to person and even changing over time. It's like your body is playing a never-ending game of whack-a-mole with your health. The complexity of lupus, though, doesn't just stop there. It can affect multiple organs, including your heart, lungs, and brain, leading to severe complications if not managed properly. But with advancements in treatment, including corticosteroids, immunosuppressants, and biologics, managing lupus has become more effective. Number 8, multiple sclerosis, often called MS. Now, imagine the wiring in your house, but instead of plastic insulation, it's covered in a protective layer called myelin. In MS, your immune system mistakenly attacks this myelin, disrupting the signals traveling from your brain to the rest of your body. Think of it like static in a phone call. The message gets jumbled. This can lead to a whole range of symptoms, from fatigue and difficulty walking to numbness and even problems with vision. It's like your body's communication system is under attack, and the messages just aren't getting through clearly. Now, the tricky thing about MS is that it affects everyone differently. So some people may experience mild symptoms that come and go, while others have to face more severe progressive symptoms that significantly impact their daily lives. MS is a disease of the central nervous system, meaning that it can affect nearly any function controlled by the brain or spinal cord. But there is hope. Thanks to advances in treatments like disease-modifying therapies, the progression of MS can be slowed, and symptoms can be managed much more effectively than ever before. Number 7, type 1 diabetes. Now, imagine your pancreas as a little factory, working hard to produce insulin. Insulin's like a key that unlocks your cells, letting sugar in to be used as energy. But with type 1 diabetes, your immune system mistakenly attacks these insulin-producing cells, throwing a wrench in the whole process. It's like the factory gets shut down, and without enough insulin, sugar can't get to your cells and starts building up in your bloodstream. This can lead to some seriously dangerous complications if left untreated, like ketoacidosis, where the body starts breaking down fats at a dangerous rate. Unlike type 2 diabetes, which is often related to lifestyle and diet, type 1 is an autoimmune condition that usually appears in childhood or adolescence, though it can develop at any age. Managing type 1 diabetes requires constant vigilance, monitoring blood sugar levels, administering insulin, and making dietary adjustments to keep everything in balance. It's a 24/7 job, and there's no vacation. But with the advent of continuous glucose monitors and insulin pumps, managing the condition has become a bit easier. Research into artificial pancreas systems and potential cures is ongoing, giving hope for a future where managing type 1 diabetes isn't quite so daunting. Number 6, Celiac Disease. Now, this autoimmune disorder affects millions of people worldwide, yet many go undiagnosed. Understanding how it works is the first step to managing it effectively. Imagine your small intestine as the gateway to your body's nutrient absorption. This vital organ is responsible for breaking down food and absorbing the nutrients that your body needs to function properly. It's lined with tiny finger-like projections called villi that help absorb nutrients from the food that you eat. Now, these villi increase the surface area of the intestine, making nutrient absorption more efficient. But for people with celiac disease, gluten, a protein found in wheat, barley, and rye, triggers an immune system response that attacks these villi. The reaction is not just a mild irritation, it's a significant immune response that can cause serious damage over time. It's like your body mistakes gluten for an invader and launches a full-on assault, damaging the very lining of your small intestine. Now, this immune response is both aggressive and persistent, leading to chronic inflammation and damage. When the villi are damaged, they can't do their job properly, and your body misses out on vital nutrients. This can lead to malabsorption, meaning your body is struggling to absorb essential nutrients, leading to a whole range of symptoms like diarrhea, weight loss, anemia, and fatigue. The only effective treatment for celiac disease is a strict, lifelong gluten-free diet, which can help heal the intestines and alleviate symptoms. Number 5, psoriasis. Now, you've probably seen the commercials with those scaly skin patches, but it's more than just a skin condition. Psoriasis is a chronic autoimmune disorder where your body's defense system mistakenly attacks healthy skin cells, causing them to regenerate too quickly. Imagine your phone constantly refreshing. That's what happens with psoriasis. These cells build up fast, forming thick, red, and often itchy plaques on the skin. And it's not just about appearance. Psoriasis can be incredibly uncomfortable, even painful, when those plaques crack and bleed. But there is good news. Advances in treatment mean that you don't have to suffer in silence. From topical creams and light therapy to newer medications like biologics, there are effective options to help control flare-ups and manage symptoms. Psoriasis affects millions worldwide and can also impact your mental and emotional well-being. Stress is a known trigger, so managing it through mindfulness, meditation, and other relaxation techniques can be beneficial. Regular exercise and a balanced diet can also help manage symptoms. Keeping your skin moisturized is crucial as well, as dry skin can lead to more itching and irritation. Remember, psoriasis is just one part of who you are. With the right care and support, you can lead a fulfilling and confident life. Don't let psoriasis define you. Number 4, Hashimoto's thyroiditis. All right, now for a condition that often flies under the radar, Hashimoto's thyroiditis. This one's a bit of a mouthful, but stick with me because it really is important. Basically, it's an autoimmune disorder where your immune system decides to attack your thyroid gland. Now, the thyroid might be small, but it's a powerhouse, producing hormones that regulate your metabolism, your energy levels, and a whole lot more. But when it's under attack in Hashimoto's, it can't function properly, leading to hypothyroidism, or an underactive thyroid. And here's the thing, the symptoms of hypothyroidism can be real sneaky. You might experience fatigue, weight gain, depression, heck, even constipation, and maybe just brush it off as stress or getting older. But trust me, if you're experiencing these symptoms, it's worth getting your thyroid checked out. A simple blood test can measure your thyroid hormone levels and help us make the diagnosis. The good news is that while there's no cure for Hashimoto's, it can be effectively managed with medication. Levothyroxine is the most common treatment, which is a synthetic hormone that replaces what your thyroid isn't making. But managing Hashimoto's isn't just about taking a pill. It's about listening to your body and making adjustments as needed. Now, some people find that diet and lifestyle changes, like eating a nutrient-rich diet and reducing stress, can also help manage symptoms. Remember, your thyroid might be small, but it has a big impact on your overall health, so don't ignore the signs. Hey, you're still finding this informational? Are you enjoying the video? Well, if you are, please subscribe and share with your friends. All right, let's keep on with the countdown. Number 3, Graves' disease. Graves' disease is the opposite of Hashimoto's. It's an autoimmune disorder that causes the thyroid to become overactive, leading to hyperthyroidism. Now, if you think of your thyroid as your body's gas pedal, Graves' disease is like someone has a lead foot and is flooring it. This can cause a range of symptoms, including anxiety, rapid heartbeat, weight loss, even bulging eyes. A condition known as Graves' ophthalmopathy. It's like your body's engine is revving too high and it's running out of control. But here's the thing. Graves' disease is manageable. Treatments like anti-thyroid medications, radioactive iodine therapy, and sometimes surgery even can help manage symptoms and regulate thyroid function. It's all about finding the right balance and keeping the engine running smoothly. For some, lifestyle adjustments like reducing stress, eating a balanced diet, and getting regular exercise can also keep symptoms in check. It's important to work closely with your healthcare provider to monitor your thyroid levels and adjust your treatment plan as needed. Graves' disease can be a wild ride, but with the right care, you can take control and get your health back on track. Number 2, Inflammatory Bowel Disease, or IB. Now, IB is a term used for two main conditions: Crohn's disease and ulcerative colitis, both of which involve chronic inflammation of the digestive tract. This inflammation can lead to severe pain, diarrhea, fatigue, and weight loss. Now, imagine your digestive system is like a highway with food smoothly passing through. But with IBD, it's like there are roadblocks, potholes, and traffic jams, causing everything to slow down and get backed up. This can be life-disrupting and even life-threatening, depending on the severity of the inflammation and complications that can arise, such as strictures, fistulas, or an increased risk of colon cancer. But there is some good news. Advancements in biologic therapies, diet management, and sometimes surgery are helping people manage symptoms and improve their quality of life. Biologics, in particular, have been a game changer, targeting specific pathways in the immune system to reduce inflammation and prevent flare-ups. And while there's no cure for IBD, with the right treatment and lifestyle changes, many people are able to achieve remission and live full, active lives. And finally, number 1, ankylosing spondylitis. Now, ankylosing spondylitis is a type of arthritis that primarily affects the spine, causing chronic inflammation and, over time, can lead to the fusion of the vertebrae, resulting in a loss of flexibility and a hunched posture. Now, imagine your spine is like a stack of blocks, and over time, those blocks start to fuse together, limiting your ability to move freely. This condition is painful and can severely impact mobility. But early diagnosis and treatments like anti-inflammatory medications, physical therapy, and exercise can help slow progression and maintain quality of life. It's all about keeping that spine as flexible as possible for as long as possible. Regular physical activity, especially exercises that promote flexibility and strength, is crucial in managing ankylosing spondylitis. Additionally, biologic medications have shown promise in reducing inflammation and slowing the progression of the disease. The goal is to maintain a good quality of life, minimize pain, and prevent long-term complications. So if you're experiencing chronic back pain, especially if it's worse in the morning or improves with exercise, it's worth talking to your doctor about ankylosing spondylitis. Thanks everyone for watching. Hey, stay informed, stay strong, and never hesitate to seek help. And if you appreciated this video, be sure to check out our video on the top 12 deadliest cancers.